Tobacco causes oral cancer. Tobacco causes cancer in almost every part of the body. Have very strong pathways because of which the tobacco is metabolized rapidly, the tobacco-related damage is repaired rapidly. Don't use alcohol, eat healthy, exercise regularly. Hello, I am Ravi Kannan and I work at the Kachar Cancer Hospital and Research Center located in Silchar. Tobacco causes oral cancer. Tobacco causes cancer in almost every part of the body. It is a fact that people who chew tobacco, who chew areca nut, who smoke, who consume alcohol have a much higher risk of developing oral cancer when compared to people who don't do any of these things. And people who use tobacco and areca nut, tobacco and alcohol, tobacco, areca nut and alcohol have an increased multiplicative risk of developing oral cancer. It is also a fact that not everybody who chews tobacco develops oral cancer, and not everybody who develops oral cancer is a tobacco chewer. But the number of people, the percentage of people who develop oral cancer when they are not tobacco chewers is very small when compared to the percentage of people who develop oral cancers because of tobacco. Now, people who develop tobacco-related cancers develop the cancer because tobacco has many carcinogens, cancer-causing agents, and so they develop oral cancer. People who chew tobacco but don't develop oral cancer are because the body has protective mechanisms against many types of insults from the environment. And these are people who, in that protective pathway, have very strong pathways because of which the tobacco is metabolized rapidly, the tobacco-related damage is repaired rapidly, and so the protective mechanisms in these people are very strong, which is the reason why, while a majority of patients who develop oral cancer are tobacco chewers, the reverse is not true. Not everybody who chews tobacco develops oral cancer. Apart from tobacco, areca nut is a very important cause of oral cancer. Alcohol is a very important cause of oral cancer. Please remember, chewing tobacco and smoking tobacco are equally injurious. Oral cancers typically develop as either white patches or red patches in the mouth. These are called precancers, leukoplakia and erythroplakia, and sometimes submucous fibrosis, whereby the mouth cannot be opened widely because of use of areca nut. Now, the earliest form of oral cancer is a small ulcer which does not heal. Any ulcer in the mouth, the tongue keeps going and probing that by reflex. And so any ulcer which does not heal within a reasonable period of time, a week, 10 days, needs to be seen by a doctor as early as possible, especially if the individual is used to consuming tobacco or areca nut or alcohol. Healthy lifestyles prevent a variety of cancers. Don't use tobacco or areca nut, don't use alcohol, eat healthy, exercise regularly, treat infections promptly. If we observe these five points, we will prevent a whole lot of cancers and also prevent heart attack, prevent stroke, improve control of diabetes, improve control of hypertension, reduce peripheral vascular disease, prevent COP, prevent a whole lot of non-communicable diseases. In other words, when we prevent cancers, we actually promote health in the community, because in addition to cancer, several other non-communicable diseases are caused by the same set of cancer-causing agents. And so we are actually promoting health in the community, which is a national responsibility. Each one of us is responsible for keeping the country healthy, because remember, only a healthy nation can be productive and prosperous. Only a healthy nation can defend itself against enemies. During treatment, there are some precautions that we need to observe, especially when we receive radiation therapy for oral cancers. We must make sure we don't keep the neck covered with tight clothing. We must make sure we don't use strong detergents and soaps and aftershaves on the face. We must make sure we don't shave the skin during radiation therapy. We must make sure we drink plenty of water and keep the mouth clean during radiation therapy. We must make sure that before starting radiation therapy, we attend to all our dental problems. It is unwise to go and extract teeth during or after radiation therapy. We must eat healthy and eat regularly, keep ourselves hydrated, and I think everything else will follow.